For the patients that I deal with, especially the ones who've been treatment resistant, it can be a tough sell for some of them. I let them know that this is kind of off-label or experimental, but that we have a lot of evidence for it based on neurology and epilepsy, and that we commonly use epilepsy treatments in the treatment of psychiatric disorders. And when I list off all of the medications, they're like, oh yeah, I've been on that, yeah, I've been on all of those. And so when I tell them, when all of those medications fail for someone with epilepsy, this diet can stop their seizures sometimes. And maybe it could stop your depression too. I think when I put it that way and let them know there's a lot of rigorous science behind this, they're usually intrigued. At this point in my practice, most of my patients are on the ketogenic diet. Interestingly, some of them read about it in the news or somewhere else, and these people were referencing my work, but I wasn't pushing the ketogenic diet on them. And they said, Dr. Palmer, have you heard about this ketogenic diet for mental disorders, for what I have, for bipolar disorder or depression? I'm hearing a lot about it. Maybe it's, and I said, actually, I do know something about that, and maybe we could try that. I think for some patients, the fact that they do have control over this, the fact that they aren't beholden to medications with horrible side effects for them sometimes. They don't have to take medications that are going to force them to gain even more weight. They don't have to take medications that are going to force them to sleep 14 hours a day because they're so sedated, and then they still feel sedated throughout the day. This treatment, quite the opposite, helps them lose weight, helps them look better, helps them feel better. And I think so many of them feel extraordinarily hopeful and extraordinarily empowered that they're getting out of the clutches of medications with serious side effects that weren't working for them. I don't mean at all to be anti-medication, and when medications work for people, I'm all for it. And taking a medication is a lot easier than doing this diet. I'll be the first to say it. But for far too many people, tens of millions of people, medications and our current treatments aren't working for them. And they're desperate. They will do anything for a better answer. And so many of them would love to lose weight on top of it, would love to feel better, would love to reverse their diabetes, get off some of those medications. And so when I talk with them about this treatment, I think they're usually very excited about it.